Hello everyone, myself Amaan Khan Jawed Pathan and I am going to attend a seminar on national level pharmaceutics video competition which is organized by Academic Deceiver Mumbai. In our group we are total 4 members and the other than me coordinators are Siddiq Muhammad Fardeen, Sheikh Akram Muhammad Hanif, Pathan Rehan Khan, and our topic is Posology. I am going to talk about Posology and I will begin by outlining definition and then highlighting the point about factors affecting Posology. So basically the term Posology came from a Greek word where posos means how much and logos means science or study. So let us see first the definition of Posology. According to pharmacology, Posology deals with the dose or quantity of a drugs which can be administered to a patient to get a desired pharmacological action. What is the use of Posology? As a field of medicine, the study of Posology focuses on the dosage or quantity of medicine that can be provided to achieve the desired pharmacological effect. Now let us see the factors affecting Posology. There are total 16 factors affecting Posology. Let us see one by one. First one is age, second one is gender, third one is body weight, fourth one is route of administration, fifth one is time of administration, sixth one is environmental factor, seventh one is emotional factor, eighth one is presence of disease, ninth one is accumulation, and 10th one is addictive effect, 11th is synergism, 12th is antagonism, 13th is idiosyncrasy, 14th is tolerance, 15th is metabolic disturbance, and 16th is tachyphalaxis. First we see the age. As we all know that there are 3 stages of age: child, adult and old age. Children and old people need a lesser amount of drug than the normal adult dose because of their metabolism and they are unable to excrete the drugs to that extent as adults. Children can tolerate relatively larger amount of belladonna, digitalis and ethanol, whereas elder patients are more sensitive to some drugs effect. For example, hypotonic tranquilizers may produce confusion states in them. Let us see the gender. Women do not always respond to the action of drug in the same manner as it is done in the men. Morphine and barbiturates may produce more excitement before the sedation in women. Special care should be taken when the drugs are administered during the menstruation, pregnancy and lactation. There are certain drugs that on that administration to the mother are capable of crossing the placenta and affecting the fetus. Example, alcohol, barbiturates, narcotics and non-narcotic analgesic, etc. Next is body weight. As we all know that the physician prescribe a prescription according to our body weight. The average dose is mentioned either in the terms of milligram per kg body weight as a total single dose of an adult weight between 50 to 100 kg. However, the dose expressed in this fashion may not apply in the case of obese patient, children, malnutrition patient. It should be calculated according to the body weight. Next one is route of administration. There are different route of administration, for example oral, topical and intravenous. In intravenous, it is directly given to the bloodstream which is having more faster drug effect as compared to oral and topical. For example, due to this reason, onset of the drug action quick within the intravenous route, this might enhance the chances during toxicity. This generally effectiveness of drug formulation is generally controlled by the route of administration. For example, when the patient faces diabetes mellitus, it is fall down, the level of sugar level is fall down, so the patient is quickly given insulin through the intravenous dose. Next one is the time of administration. The presence of food in the stomach delays the absorption of drug. The drug are more rapidly absorbed from the empty stomach. So the amount of drug which is very effective when taken before a meal may not be that much of effective that taken after the meal. The irritating drugs are better tolerated if administered after meals. For example, iron, arsenic and cod liver oil should always be given after meals and some antacids are given before the meal. Next one is environmental factor. Daylight is stimulate stimulant, enhancing the effect of stimulating drugs and diminishing the effect of hypotonics. Darkness is sedative. Hypnotics are more effective at night. The amount of barbiturates required to produce sleep during the daytime is much higher than the dose required to produce sleep at night. Alcohol is better tolerated in cold environments than in summer. Next one is emotional factor. As we all know that females are more emotional than males and require less dose of certain drugs. The personality and behavior of the physician may influence the effect of the drug, especially the drugs which are intended for the use of psychometric disorders. Another one is the presence of disease. The disease like liver cirrhosis, in which the drugs like barbiturates may produce an unusual prolonged effects in the patient. Streptomycin is excreted mainly by the kidney, may prove toxic if the kidney of the patient is not working properly. Next one is the accumulation. The drug which are slowly excreted may be pulled up a sufficiently high concentration in the body and produces toxic symptoms if it is repeatedly administered for a long time. Example, digitals, amidine and heavy metals. These occur due to the accumulative effect of the drugs. Next one is addictive effect. When the total pharmacological action of the two or more drugs administered together is equivalent to the sum of their pharmacological action, the phenomenon is known as the addictive effect. For example, a combination of ephedrine and aminophalin in the treatment of bronchial asthma. Next one is the synergism. The term synergism means the two or more drugs which are usually used in the combination, their action increases. This phenomenon is termed as synergism. For example, the ability of a mammary gland to produce secrete milk requires the synergistic action of many hormones such as estrogen, cortisol, prolactin, oxytocin and others. Next one is antagonism. When the action of one drug is opposed by the other drug on the same physiological system is known as drug antagonism. The use of antagonistic response to the milk is valuable in the treatment of poisoning. Example, milk of magnesia is given in acid poisoning where the alkali effect of milk of magnesia neutralizes the effect of acid poisoning. Next one is idiosyncrasy. An extraordinary response to a drug that is different from its characteristic pharmacological action is called idiosyncrasy. The word idiosyncrasy has now been replaced by the term allergy, drug allergy. For example, a small quantity of aspirin may cause gastric hemorrhage and a small dose quinone may produce ringing in the ears. Next one is tolerance. When an unusual large dose of a drug is required to elicit the effect of ordinary produced by the normal therapeutic dose of the drug, the phenomenon is termed as a drug tolerance. Example, smokers can tolerate nicotine and alcoholics can tolerate a large quantity of alcohol. Next one is metabolic disturbance. Changes in water electrolyte balance and acid-base balance, body temperature and other physiological factors may modify the effects of drug. Salicylates reduce the body temperature only in the case an individual has a rise in the body temperature. They have no antipyretic effect if the body temperature is normal. And the last one is tachyphalaxis. A rapid diminishing response to a successive dose of a drug, rendering it is less effective. The effect is common with the drugs acting on the nervous system. So I collect all the information from a book of pharmaceutics by R.M. Mehta, a book of pharmaceutics by Nirali Prakashan, and a source of Wikipedia. This is all I wanted to say about, and thank you so much for listening.